There is a lot of talk these days about HIV and AIDS, HBV or hepatitis B virus, and the dangers of getting infected by coming into contact with someone else's blood. In your profession, you can face many situations that could potentially cause you to come in contact with blood or body fluids from other individuals. Whether it's removing trash that contains a used syringe, handling laundry soiled with blood, or simply cleaning up after a sick child, the precautions you follow for handling these procedures could mean preventing serious illness or even death. That's why OSHA, the Occupational Safety and Health Administration, has developed the Bloodborne Pathogen Standard to provide guidelines that will help you eliminate, or at least reduce, your exposure to HBV, HIV, and other bloodborne pathogens while in the workplace. This video, which is included in Betco's university training courses, focuses on OSHA's Bloodborne Pathogen Standard for the workplace. This video will cover what are bloodborne pathogens, who is covered by the OSHA Bloodborne Pathogen Standard, what is exposure, following universal precautions, protective practices, what if exposure occurs, HBV symptoms, HIV symptoms, and employer responsibilities. Betco has over 300 specialty cleaning products and a full line of equipment and accessories. Prior to using any cleaning chemical, be sure that you read the label and consult the safety data sheet for that product. Before going any further, let's provide a definition for bloodborne pathogens. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, HBV, and human immunodeficiency virus, HIV, associated with AIDS. OSHA originally developed the Bloodborne Standard for healthcare and hospital employees, but it has been expanded to include any occupation in which reasonably anticipated contact with blood or other potentially infectious materials may occur, including someone who may be responsible for the cleanup of blood or body fluids, or even those who remove trash or handle laundry. Within these settings, there may be potentially infectious materials, and how you take care of them can literally make the difference between life and death. Most occupational exposure to bloodborne pathogens occurs when the pathogen comes in contact with the employee's mucous membranes, like the nose or mouth, or breaks in the skin, like needle sticks, human bites, cuts, or abrasions. Body fluids such as blood, vomit, and in some instances, saliva, can potentially contain bloodborne pathogens, but you can easily protect yourself from coming into contact with the fluids by following universal precautions. The Centers for Disease Control and Prevention established the Universal Precaution Approach, recommending that blood and certain body fluids from all patients be considered potentially infectious, and that infection control precautions be taken to minimize the risk of exposure. This is the approach taken by OSHA in the Bloodborne Standard. The best defense is a thorough offense. Always follow universal precautions, as well as your facility's exposure control plan when handling contaminated materials. This means that at all times, assume that all blood and most body fluids are contaminated with bloodborne pathogens, and that you should follow proper protective practices when handling a cleanup or an exposure. Alternative color coding or labeling of laundry is acceptable if all of the soiled laundry is handled using universal precautions, and the labeling or color coding is sufficient to let all employees know that compliance with universal precautions is required. If laundry is shipped to a location that does not use universal precautions, the bags or containers must be properly labeled and color-coded red or orange. Remember that needles or other sharp objects may be hidden within the laundry. Wear personal protective gear if you are responsible for handling contaminated laundry. Besides protecting yourself, you are responsible for containing the bloodborne pathogens and decontaminating the area so someone else isn't exposed. It is crucial to clean and disinfect the area with the appropriate disinfectant cleaner. After a cleanup procedure, always remove and dispose of your gloves and other equipment in a properly labeled container or a red or orange infectious waste bag. Thoroughly wash your hands with a hand cleaner immediately after you remove the gloves, goggles, or other personal protective equipment. Good hand washing helps reduce the spread of infection and disease. All containers and cleaning equipment, such as mop buckets and tongs used during decontamination, must be disinfected following use. If there is any chance that you have been exposed to bloodborne pathogens, contact your supervisor immediately for specific instructions on exposure protocol. Also, notify your physician. Once an exposure occurs, be sure to pay attention to your health and watch for any symptoms that are related to HIV or HBV. Hepatitis B, or HBV, is a type of liver disease that inflames the liver and leads to liver damage and sometimes even liver cancer. HBV has the following symptoms: fatigue, abdominal pain, loss of appetite, nausea, jaundice, vomiting, diarrhea, light-colored stools, and dark urine. HBV symptoms may not appear for some time after initial exposure. Notify your healthcare provider immediately if you think you may be at risk for HBV. Hepatitis B vaccinations must be made available at no cost to all employees who have occupational exposure. Vaccinations must be provided after initial bloodborne pathogen training and within 10 working days of any assignment, which could result in occupational exposure. If someone should contract HIV, they may develop AIDS, or acquired immune deficiency syndrome. Symptoms of HIV infection could include constant fatigue, sore throat, persistent fever, persistent rash of unknown origin, night sweats, persistent swollen glands, mild to severe flu-like symptoms. Just like HBV, HIV symptoms may not appear for many years after the exposure. If you think you may be at risk for HIV, contact your healthcare provider immediately. OSHA requires that each job site in which there is a reasonable likelihood of bloodborne pathogen exposure have a written exposure control plan, and it must be kept updated. Reviewing the plan, at least annually, is an important part of knowing how to protect yourself. Your supervisor should provide a copy upon request. OSHA requires specific documentation from your employer. When an exposure occurs, your employer must maintain certain records for 3 years after the exposure. Now that you understand OSHA's concern for your health and safety, take time to see how your employer has responded to the challenge. You may want to read your facility's written exposure plan. Always take universal precautions when there's a chance you could be exposed to bloodborne pathogens. Remember these protective practices when you're facing bloodborne pathogen concerns. Always wear personal protective equipment. Never eat, drink, smoke, or apply lip balm in areas in which there's a possibility of bloodborne pathogen exposure. Never manually compress trash. Avoid splashing or spattering when cleaning up. Never reuse towels or sponges. Use spatulas, absorbents, or tongs for cleanup, when possible. Handle contaminated laundry cautiously. Use properly labeled or color-coded containers and bags when disposing of or transporting materials contaminated with bloodborne pathogens. This includes gloves, laundry, and equipment. Always decontaminate surfaces and/or areas with Betco disinfectants. Always properly wash your hands. Disinfect equipment and materials used for cleanup. And if you think you may have been exposed to bloodborne pathogens, contact your supervisor and physician immediately. If you need more information, ask your supervisor or check out the OSHA website at www.osha.gov. You can also contact your regional OSHA office. Remember, you play an important role in preventing or reducing contact with bloodborne pathogens to others as well as yourself. Be proud that you and your employer have taken the time to learn more about the OSHA Bloodborne Standard and use your knowledge to make a difference in creating a safe, clean, and healthy environment. Employees in a healthcare setting have an even greater risk of exposure to bloodborne pathogens. Here are some additional guidelines developed for your protection. Do not bend, recap, or remove contaminated needles and other contaminated sharps. Put contaminated reusable sharps in designated containers until they can be properly reprocessed. These containers must be puncture-resistant, labeled or color-coded, leak-proof on the sides and bottom. Regularly inspect and decontaminate all bins, pails, and other containers that may have come into contact with infectious waste, such as needle bins or trash receptacles. Of course, follow universal precautions and dispose of all regulated waste according to all applicable local, state, and federal regulations for infectious waste disposal. If you need more information, ask your supervisor or check out the OSHA website at www.osha.gov. For more information, please visit www.betco.com or call 888-GO-BETCO.